Probiotics are made up of various microorganisms, like yeast and bacteria, which are naturally found in the stomach, intestines, and vagina. They help to restore the normal balance of bacteria and yeast, especially after conditions like antibiotic use or travel. Probiotics can be used to improve digestion and treat conditions such as diarrhea, irritable bowel, eczema, vaginal yeast infections, lactose intolerance, and urinary tract infections. You can find probiotics in foods like yogurt, milk, and juices, as well as in dietary supplements like capsules, tablets, and powders. It's important to check the label for information on how to use your particular product. If you're using a dietary supplement, consult with your pharmacist to ensure it's safe and effective for you. As always, it's best to consult with your doctor or pharmacist for more details on the best time and dosage for taking probiotics. Make sure to follow the instructions on the product package. Check the label to see if the dose should be swallowed whole, chewed, sprinkled onto food, or mixed with liquid. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon. Do not use a household spoon as it may not give you the correct dose. If you have any questions, it's best to consult your doctor or pharmacist. Some probiotic products contain live bacteria, such as bifidobacteria. If you're taking antibiotics, they may affect how well the probiotics work. It's recommended to take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics. Be sure to follow the directions for your specific product. If you're using this product for diarrhea caused by antibiotics, do not use it if you have a high fever or for more than 2 days without consulting your doctor. It's important to seek medical treatment if you think you may have a serious problem. If your condition doesn't improve or gets worse, or if you suspect a serious medical issue, it's crucial to seek medical help immediately. If you experience increased stomach gas or bloating, make sure to notify your doctor or pharmacist. Serious side effects may include signs of infection, so it's important to consult your doctor right away. While a serious allergic reaction to this product is rare, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects. As for the optimal timing, it's best to take this medication as directed by your healthcare professional. Before taking women's probiotic 25 billion capsules, it's important to talk to your doctor or pharmacist if you have any allergies or health conditions. If you have diarrhea lasting more than 2 days, a weakened immune system, recurring vaginal or urinary tract infections, diabetes, PKU, or if you're pregnant or breastfeeding, it's best to consult a healthcare professional before using this product. It's also important to inform your doctor about all the products you use before having surgery. If you're pregnant or breastfeeding, make sure to discuss the risks and benefits with your doctor before using this product. Always consult your doctor before starting any new medication. As for the best time to take this, it's recommended to follow the dosage instructions on the product packaging or as directed by your healthcare professional. It's important to be aware of potential drug interactions with probiotics, as they may affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some medications that may interact with certain probiotics include antibiotics and antifungals like clotrimazole, ketoconazole, griseofulvin, and nystatin. Always consult with your doctor before making any changes to your medication dosage. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Make sure to attend all your medical and lab appointments as scheduled. Certain brands of this medication may also include additional ingredients like fiber or inulin. If you're unsure about the ingredients in the brand you're using, consult with your doctor or pharmacist for clarification. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing probiotics, it's important to follow the specific instructions on the product package. Some may need to be refrigerated, while others should not. If you're unsure about how to store your probiotics, don't hesitate to ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes to discarding probiotics, it's important not to flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, make sure to properly dispose of expired or unneeded products. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.